My, that's a big crowd. As I says, my name's Neil Wilson. I work for AXA Health, and Rob's asked me to come down this morning basically to give you an overview on private medical and why it's important for your business. Quick show of hands, anybody got private medical at their business? That's good, that's good. I think in the past private medical's had a few myths about it, that it's expensive, it's only for directors, it's not for the average working man, but that's changed a lot over the years. First thing is, what is private medical? It's got a lot of names: private health insurance, medical care, etc. Basically, private medical is designed to cover acute treatment, conditions, long-term problems, but we don't cover chronics. But the whole idea is choice. There's a lot of things on there, but basically the idea of private medical is to give you choice. It's to give you which hospital you go to, who you see, when you see them, and when you get treated. That's it in a nutshell. Basically, nothing complicated, just that. We all know at the moment NHS is under strain. You can't see a GP. Private medical, since COVID, is taken off. We've had 4 record years for SME, individual, large corporate. And there is other providers available if you wish. And we all know they have had record years as well. So why is it important to you guys? Well, first thing, fewer GPs. Try to get a GP appointment now. You're lucky if you can get one within 2 weeks. If you've got private medical, you can virtually, if you want to see the virtual GP, have an appointment the next day. If you want to pay for private GP visits, we can give you a module and basically you can go and see a private GP. But as we all know, you've got to know you're going to be sick 3 weeks before to see your GP. So that's one side of private medical. It gives you access to a GP. There was a lot of stats and figures not available, but I thought they were the most impressive too. The wait time since COVID for any treatment virtually is 14.4 weeks. It's gone up from 6.9 weeks. If you're in an emergency, yes, you'll be treated, but hips, knees, anything else, you've got a long wait. There's around about 7.4 million individuals on the waiting list now. That's according to figures of January 25. Imagine if you want some treatment and you've got to get on that list. With private medical, you get your referral, you go, you ring up your provider, they'll book you in for your appointment. You can be within 4 to 5 days in having your treatment. The demand's changing now for private medical as well. As I said before, people viewed it as something that only posh people had, or it was very expensive. People have got an increased knowledge of health with social media. You're all wearing watches that can measure your blood pressure, your heartbeat, etc. They're more aware of health. They want to look after their health. Private medical isn't just for surgery, it's there for well-being. We have loads of modules that can help your well-being. Ease of use. In the past, it was difficult. Just to give you an example, before I joined 11 years ago, you had bronze, silver, gold, executive, VIP, all these different levels. Now you've got 2, and that's it. We've made it so easy for you to access it. It's all modular. You can put on as much as you want, take off as much as you want, be as expensive as you want, as cheap as you want. It's much easier to use, and with as I say, with watches, etc., makes life a lot easier. Increased facilities with private healthcare, more and more private hospitals springing up with more modern technology. We've got one in the Shard down in London Bridge, some fantastic machines there. And the beauty about private medical, as I said, it's choice. If you choose the module with the one hospital list, if you wanted to go to this hospital in the Shard, you could. We wouldn't stop you. That's part of your membership. Again, There's a renewed focus on health and well-being. People are more aware of what they want, and it's now become a valued employee benefit. When I joined AXA, private medical was something like number 6 on the most popular employee benefit. Since COVID, it's now become number 1 in a lot of cases. People want private medical. So you're supporting your employees, and as it says, demand for private healthcare has grown among the SMEs. When I joined, we were getting about, on the small enterprise side, we were getting about 30, 40 quotes every week. We're now getting maybe 400 to 500 every week, a couple of thousand every month. And that's from businesses that only employ one person up to 65, which is what we normally call an SME. But mid-corporate would be 100, but we can do SME at 100. So the demand is out there, but particularly among the smaller enterprises. So what it means to you, well, that's a lot of bullet points, but basically I think they're all very relevant. It's now viewed as a number one employee benefit by staff. As I said, we were number 6. We are now number 1. Absence management. Basically, a lot of staff off sick. They're waiting for GPs, referrals, or they're waiting to go into hospital. It helps manage your absentees. Employer of choice. A lot of people now expect it if they're going to join an employer. If you can offer private medical, it makes you want a choice over somebody who doesn't. Saving money. Saves you money because if your staff are off on sick, they're at work, they're being productive. So although you may be paying for the staff private medical, it is saving you money. You've got a healthier workforce, less sick days. It adds value to the company profile. Better choice for employees. And by offering it to them, it gives them a choice of when they can be treated. You foster good employee relations, and you do create a happier and healthier workforce. They're not all sitting there moaning about their back, their knees, because they can go and see a physio the next day, or they can be treated for it. How it works. Basically, you do have, there's 4 choices of private medical, but for you guys, it's mainly SME, corporate or global. We can do small businesses. As I say, we can do corporate and global. If you've got people working abroad, we can do private medical for them abroad. I hate to repeat myself, but why PMI? Because it gives you access to diagnostics and treatment. You get your choice of appointments, you get your choice of specialists. And it's an improved ratio. When you go into the private hospital, you've got a private room, good conditions. It makes a healthier workforce. I'm not going to go too much into the cover options, because if you are interested, I'm sure Chris or Paul can put a quote together for you, or you can come and talk to me later. But basically, as I said, in the past, you had this litany of different things you had to pick. Now it's very easy. Treatment, an in or day patient, therapies, mental health, cancer treatment. You can put as many of them on as you want, or as few. Very modular, very simple. We do have 2 products. We have Business Health, which if you're using a car analogy, that's the Rolls Royce, and Business Protect, that's probably a Ford Mondeo. You can pick either one. At the moment, Business Protect is only available if you don't have existing cover, but if you can't afford Business Health, you can go to Business Protect. The only difference is your hospital choice is less, and that's it. That is the modules. That's what you would have to pick from. Included as standard, you've got a 24/7 health support line. That's got midwives on, pharmacists, nurses, counsellors. Ring them anytime. Phone and online support for muscles and bones. That's your physio line. I've used it myself. Try to swing too hard on the golf course and put my back out. Basically, don't need a GP referral. You ring up the line of physios and they'll book you in. Online GP service, that's your video GP, as many consultations as you would like. Specialist appointment booking service, that's to get you there as quick as possible, see the consultant of choice. And we do offer discounts on things like Nuffield gyms, etc. The other cover options is, as I mentioned, you can pick as many of them as you want or not. It's entirely up to you, entirely what you think suits your business and your workforce. We always get asked, how do you make a claim? Dead simple, 4 steps. See your GP, ask for an open referral. You then call the claims line. They check your cover, see which hospital do you want, book you in to see a consultant, and you're away. And as I say, normally you're in hospital within 4 to 5 days of doing the phone call. As I say, there's other providers out there. Why AXA Health? Comprehensive coverage. We've got over 450 hospitals on our list. Huge network of health providers, scanning centres, etc. We do offer wellness programs. We've got a global option if you've got people working abroad. Good customer support. All our call centres are UK based, spread throughout Scotland and Wales and Ireland. Flexible and customisation. Yeah, it's flexible. You can put on what you want, take off what you want. When it comes to renewal, it's a yearly plan. You can change it around. Everybody here probably thinks Bupa is the #1 healthcare provider. And they are. They've got about 36% of the market. However, AXA have been doing it longer. We've been doing it since 1948. So we do have quite a good reputation. Digital, we are trying to make everything digital. So for you guys, it makes it a lot easier for you to get appointments, get in touch with people, apps on your phone, etc. Limitations, basically, we have very few on our policies. That's just to give you some idea of who we are and where we are. Any questions at all? Nope. Thank you very much. That was easy.